We are just going to wait another minute or two to give everyone a chance to join. There was an issue with the invite that was sent and an updated link happening. Okay, good morning, everyone. We are going to go ahead and get started. I have a feeling we'll have some others join us after we do so, but thank you everyone for being here today for our NEMT Commission meeting. My name is Lindsay Lux. I am the Medicaid Deputy Director and Chief of Staff, and I serve as the chair for this commission. I will take attendance. Jamie, if you'd like to flip, there we go. I'll be taking attendance, so if anyone is unable to unmute their line, please feel free just to enter your name in the chat when I get to you, and that is not a problem. Andy Van Zee.
Here.
Thanks. Dr. Yazel. Gary Miller. Kim Dodson. Jim Degliamberto.
Here.
James Fry. Fern Merkin. Sherry Hampton.
Here.
Thanks, Sherry. Kristen Lais. Maureen Lindsay. I am here. Representative Pressel. Representative Boy.
Here.
Thank you. Senator Becker. Senator Bro. Okay, I have entered a note in the chat for anyone who wasn't here during attendance to enter their names. Like to go ahead, Jamie? Today on our agenda, we really have two topics to discuss. The first is the usual Verida performance and access. Jim Degley-Umberto, the Verida COO, will be presenting. And just a reminder to everyone that SET or Southeast Trans did change their name to Verida. Next on the agenda is our NEMT, our fee-for-service NEMT contract readiness review. And Jamie Saeed, the Medicaid Director of Administration, will be presenting to discuss our process and progress there. And then we will wrap up. So Jim, I will turn it over to you.
Great. Thanks, Lindsay. Good morning, everyone. Jamie, are you? There you go. Great. So just a quick look through some of the NEMT numbers that we've seen fourth quarter, first quarter, calendar year 5 versus calendar year 6. You'll see call volume has decreased from 49,000 calls per month down to, or quarter, down to 40,000. That's mainly due to the impact of the nursing home and EMS carve out that was implemented in July of 2023. And you'll see that trend or that impact of the carve out on the majority of our numbers throughout today's presentation. So you'll see that the members served, the residents, the Medicaid recipients in Indiana using the services has dropped down to 6,910. And consequently, the trip volume has dropped from 70,328 to 59,855. It's roughly a 15% reduction in monthly trip volume. We've seen some recovery from the pandemic, which will be, you'll be able to see a little bit better in some of the visuals later in the presentation. But that's now been countered by the carve out. So when you're looking at the trends, this is, it's an interesting year for NEMT in the state as things are transitioning, back from the pandemic or out of the pandemic and the public health emergency now into this carve out. So we see a lot of variation in the usage of the service, the call volume, the trip served, the member served. The other stats remain relatively similar in terms of percentages. Our ambulatory volume, members using the services who can walk and get on a vehicle, still remains the largest portion of the services that we provide, followed by wheelchair. You'll see public transit is listed. That is another method of transport that we provide as an option. So if you are a member, a Medicaid recipient who lives on a public transit route and you are going to a facility, a medical appointment that is also on a public transit route, our trip management system will our trip management system will identify this trip as public transit eligible. And we integrate with the transit agencies in the state as well as Google Transit to match up routes and stops as it relates to passengers pickups and drop-offs. So that is another alternative for members seeking transportation. Of course, there's also fuel mileage reimbursement where we will reimburse if the passenger is able to use a vehicle for transport. We will be able to reimburse for fuel. What you'll see in the next two numbers, your active providers and active vehicles, you'll see a decrease, but that is really a result of the carve out. The reduction of providers is due to the EMS carve out, EMS providers no longer being in the network and those vehicles coming out of the network. Also, nursing home facilities that were providing their own transportation, again, those providers and vehicles have come out of the network. Next slide. So this is the trip volume trend that I was referring to just a second ago, the month over month trip volumes. And what you'll see, calendar contract year 5 to 6, we were coming back, trending up from the pandemic. And then with the carve out in July, you'll see, that dramatic decrease from, 71,000 trip legs in June of calendar year or contract year 6 to the 57,000. So, it's seasonal, right? Trips go up and down based on the time of the year. But we do expect, the carve outs to have impacts on the trip volume. Next slide. Complaints, complaints, we're still at 99.9% complaint-free trips. You'll see that the number of complaints has decreased. Trip volumes decrease, members decrease, there's less opportunity, but still at a 99.9% complaint-free trip. The spike that you see in November, September, October, November, we had a provider in the network go out unexpectedly in November of contract year 5. You'll see that complaints were high. We quickly were able to backfill that transportation provider and get things moving in the right direction. So looking December through where we are today through September, you'll see that trend line decreasing from 21 down to 14 complaints in September of contract year 6. Overall member experience, customer satisfaction, we're averaging 96% customer satisfaction regarding the call center. So this metric is one that we capture. We have a third party capture member satisfaction with our call center the day after they call into the call center. So the Medicaid member will call in to schedule a ride today for an appointment in the future. If randomly selected tomorrow, they will be called by our third party customer sat company, who will then survey that member regarding their experience in the call center. And so we're averaging 96%. It does fluctuate from time to time, but we are consistently in the 90s and the upper 90s for the last few months.
Hey, Jim, what is the response rate on that satisfaction survey?
The response rate, there's a minimum number of surveys that we capture for the call center and for the transportation. I believe it is 50 per month on the transportation and on the call center. We also capture IVR surveys. So if they opt in, we have the ability to survey that member regarding their trip using a simple IVR call. So it's not a live third party survey, but it's another survey that we do provide. And that opt-in rate has decreased over time because to be honest, the same members tend to take trips, right? So they can opt out of receiving that survey. Now the IVR lists we get about 4,000 surveys per month on that IVR automated survey. It's a lot less on the live third party survey, but they do track in terms of satisfaction. They do correlate in terms of the high percentage between both. Again, this is the transportation provider surveys, same concept. The day after the transport, that member is contacted by the third party and ask questions regarding their experience, and then we track that here. And again, we're averaging 94% on the transportation network. Regarding the transportation network, the areas of need. Now, this slide has evolved over the years. If you'll recall, there were quite a few more counties that we've deemed areas of need. And an area of need is a county where we have missed more than 2 trip legs per day, or one round trip, 2 trip legs per day. And since our last meeting in June, we've removed a number of counties. 5 counties have been removed since June: Allen, Madison, Porter, Vandenberg, and Vigo. The 3 counties that remain, Elkhart, Lake, and Marion, those counties, you'll know, are the Lake, Marion, high volume, right? Densely populated, high volumes of trips. And again, an area of need, we're missing 2 unassigned legs per day. So we are working to develop those areas those regions with transportation providers, but just due to the sheer volume of trips in those counties, they do tend to end up on this areas of need. The good news is five have been removed from this map. Again, speaking of new transportation providers and building out that pipeline, we do have, as of September 30th, 12 credentialing. That accounts for 108 vehicles. Again, we focus the recruitment. So our transportation provider managers, our PRMs, they will work primarily in those areas of need, looking to bring in transportation providers to cover those counties and those regions to ensure that we are limiting missed opportunities for transports. Again, the existing network, 148 providers and 1,250 vehicles. We continue to grow the network. Again, the network is relatively stable coming out of the pandemic, which is a good thing. We do have attrition or providers come and go. Again, I mentioned earlier that one in, I believe it was November, who left unexpectedly. But we are constantly recruiting new transportation providers to increase the capacity of the network. Next slide. Provider safety in Q1, 100% vehicle inspection rate. We've inspected 403 vehicles. Everyone has passed. These are scheduled inspections, vehicle inspections. We also do what we call spot inspections, which are kind of on the spot inspections. We will show up and inspect a vehicle. We've completed 198 of those with 100% pass rate. We do all of those inspections electronically using a mobile app that captures all of the information that we need. There's a form that's filled out. So it's completed at the scene. There's pictures that are associated with the inspection that are attached directly to the report using the mobile device. So it's really streamlined and gives our compliance team great access to see the vehicles that are being inspected. We've done 75 wheelchair securement inspections. I mean, the wheelchair securement is key. You want to make sure that wheelchair is secured properly, proper straps and tie downs to ensure securement, that wheelchair securement, wheelchair accidents and incidents, those could be severe. So we take a diligent approach, ensuring that we are doing the best that we can to monitor wheelchairs, accidents and incidents for the year. 28 reported this contract year, and 99.99% of the trips are completed without accident or incident. Okay, and lastly, we just wanted to touch on some of the ways that members can interact with Verida to schedule rides. And we talk a lot about the call center metrics, and the call volume that comes in to schedule rides, to confirm rides, and to request a return ride from your doctor's appointment when your appointment is done or completed. But we do offer online options for members as well as facilities to schedule rides, self-service, right? So there is a member portal, which is just a website that we've developed that's in use at our markets. It's in use in Indiana, where members can register to use the portal. They can log in, they can schedule rides, they can see rides that have been scheduled. They're able to rate their rides. So there's another option for customer satisfaction outside of the third-party surveys and the IVR surveys. If you're scheduling rides through the member portal or the member app, you do have the ability to rate that transport, 1 to 5 stars. So there's another opportunity for feedback regarding your transport. But year to date, we've registered 747 members in Indiana to use the portal. They've scheduled a little over 7,000 trips. If you go to the next slide, you kind of see some of the underlying technology behind it. There's an online form that you're completing. There's required field. It's very similar in terms of the flow that the member would experience when calling into the call center. It's just you're walking through that form or that script online through your web browser. You can, again, schedule trips. You can check the trip status. You can submit complaints. You can submit compliments through the portal. There's you're able to contact us. There is a help desk or a knowledge base section for frequently asked questions. And again, you can see your trips, rate your trips after they've been completed. So the member portal was developed in 2015, really before mobile apps came on the scene. Since then, we've developed, the next slide will show you the member app, which is a smartphone application available on the app stores, Google Play. So it's available on Android, on Apple, the same functionality, the same features as the member portal, just on your phone in a native app. So again, you can schedule trips, you can check the status of the trip. You're able to manage fuel reimbursement is a new feature that we're developing and rolling out. Again, submitting complaints or compliments, the contact us, the support pages, all of that embedded into the app. Great. I'll turn it over to Jamie. Thank you.
Hello, everyone. Today I'm going to talk about the NEMT contract readiness review process. And so first, what's a readiness review? So readiness review is an assessment of a vendor's readiness to support the contract requirements and performance standards. How do we approach this readiness review? Well, first we start by aligning FSSA leads and Verida leads for contract sections or functional areas. And we do this to facilitate meaningful interaction where FSSA leads can best assess Verida's ability to fulfill the contract requirements at the standards set within the contract. The leads for each contract section are chosen based on subject matter expertise. Then in this process, the readiness review project management team develops a readiness review log and other tools for the readiness review process. And the logs and the tools are key to ensure organization of the readiness review process, standardize the readiness review process, and ensure that there's transparency and seamless collaboration throughout this process. Next, we work with the project management team to develop validation methodologies for the contract requirements. And what we do with this is decide what is the best mechanism for Verida to provide proof it can meet the contract requirements and performance standards under the new contract. Then we initiate the readiness review with an on-site discovery session. And the purpose of this on-site discovery is that it sets the tone for the readiness review. It allows us to identify areas of focus and the best timelines to apply to certain areas of the contract based on the work needed to assess readiness in that area. So for example, if there's a contract requirement, and then there is a contract requirement in the new contract that providers have to give written notice before they can stop standing trips. And that means Verida is going to have to amend contracts with their providers. So we want to get on that early and make sure that process is starting early so we can review the new contract and get that implemented by the time the contract's implemented. This process also helps us refine the validation methodologies so we have an efficient, thorough review. Next, the readiness review, desk reviews, and document submissions occur. Many of the validation methodologies used are Verida documents such as policy plans and training materials that they use with Verida staff. These documents are provided to the FSSA leads to determine whether contract requirements are met or whether the documents need to be returned to Verida for further development. Upon review, FSSA leads assess readiness and identify and manage action items to close the gaps. So after FSS lead determines, yes, Verida is ready to meet the contract requirements, or no. For example, if no, the FSSA lead is going to provide feedback on the gap so Verida can make adjustments and align better with the contract requirements and instill confidence that the performance standards will be met. And finally, we'll do an on-site walkthrough of Verida's operations. We do this to view the day-to-day activities and physical environment. We receive work system demonstrations, and we do side-by-side observations with Verida staff as they work, such as side-by-sides with the call center staff when they intake calls and schedule rides to fully understand whether Verida is ready to perform under the requirements of the new contract. So this slide provides a visual overview of the readiness review process. Again, the goal of readiness review is to ensure a vendor is ready to comply with the requirements of the new contract. As we go through the process of reviewing the various validation methodologies, such as document and system demonstrations, interviewing Verida staff, subject matter experts in each area under review, such as their call center operations experts, their program integrity experts. We compare what we review to the contract requirements and only determine that Verida is ready if the FSSA reviewer has complete confidence that Verida is prepared to support the requirements of the new contract in that area. If the FSSA reviewer does not have complete confidence, they provide a readiness disposition of no and provide Verida detailed feedback on what needs to happen to demonstrate readiness to perform in the contract area and meet performance standards. This process can take more than one time of review and providing feedback to Verida. So we make sure the threshold of complete confidence is met before we say, yes, Verida is prepared to support the contract requirements. Now, to be clear, even though Verida is an incumbent in NEMT broker, we're approaching this readiness review activities with the same way we would with somebody brand new coming in. So this is a very thorough, robust review of Verida's ability to meet the requirements of the new contract, which have changed in some parts. So we'll go over some of the accomplishments today, and this really reads in and of itself. So we started by conducting project kickoffs with the FSSA team and Verida teams that are working on the readiness review. We established an external collaboration site for FSSA and Verida so we can keep in constant communication and close those gaps for readiness. Our project management team developed a readiness review log and other project support tools. They developed comprehensive validation methodologies for the contract requirements with us. We also had training with the FSSA team leads on the readiness review lifecycle, including the document review process and use of document review and demo feedback forms, document version control, and capturing the readiness review results so that all the team leads are working about this the same way. We developed a high-level functional area groupings of requirements to facilitate on-site discovery approach and agenda. So we tried to put items together from the contract that matched up with the leads that would be working on them. We conducted an interactive on-site discovery session. I was with FSSA and the Verida teams. We met at their location and they went through their processes with us and went through each area of the contract. We published initial document requests and have 70 documents. At this time, it's a little bit more than that under FSSA review for evidence of readiness to comply with the new contract. We established a prioritization and schedule for the delivery of additional documents, schedule an initial set of demonstrations and subject matter expert interviews where we'll go in and have Verida demonstrate their systems and we can interview their subject matter experts in the various areas of the contract to determine whether they're ready. We initiated transition plannings of the Pathway for Aging program members too, because the dates of the start of the contract, the new contract with Verida and the Pathways program align, just to make sure that members seamlessly transition from the NEMT brokerage to their managed care entity. So the next 3 slides just provide some examples of how we take sections of the contract requirements and choose the appropriate mechanisms to determine whether Verida is ready to support the contract requirements in that respective area. So this is like a little snapshot of some of the tools and spreadsheets. So the focus area, for example, in complaint investigation, what we determine we need to validate that Verida is ready to perform under the contract in this area is we want them to submit for review a summary report, which lists and includes analysis of all complaints and appeals received. We'd like them to submit examples or a demo of the data analysis and complaint and appeal data. So that's for that one section. Another section, for example, for transportation network companies, we'd like Verida to submit for review a TNC engagement plan with all the required sections as outlined in the requirements. We'd like them to identify points of contact for ongoing maintenance of this plan and managing relations with the TNCs. And we like them to perform a system demo to see how the vehicle data are entered, maintained, billed, archived, and audited. Staffing levels and qualifications. We've asked Verida to submit a staffing plan and an organizational chart for our review that at a minimum addresses all the requirements and qualifications and how they'll be met. For member communications in that area, focus area, we asked Verida to perform a demo of the member website, member portal, and mobile app to show us that all the functionality and content requirements, including information that members need related to the advanced life support, basic life support, and nursing facility. In the focus area of incident reporting, we're asking Verida to submit documentation for review describing how accidents and moving violations are internally reported, documented, externally communicated, and tracked. And then finally, hospital discharge. In that focus area, we've asked Verida to submit for review policies and procedures for accommodating discharge requests from hospitals, emergency departments, psychiatric treatment facilities, and other inpatient facilities with pickup and transportation occurring not to exceed 3 hours from the request and being available 24 hours a day, 7 days a week. We want to make sure they hit that contract requirement, and these are the mechanisms that we determine will help us determine whether they can. And finally, clarity on membership and program characteristics. So we're asking in this area, focus area, for Verida to submit for review how the broker coordinates benefit responsibilities with non-broker entities that administer other health benefits and carved out services. We also ask them to submit for review how the broker monitors the regulatory landscape. So that just gives some examples, and there's many, many more focus areas that were determined with various validation methodologies. As I said earlier, it's a very robust, thorough process. And the goal is to make sure that we have complete confidence that Verida can meet those contract requirements and performance standards that are set within before go live. So go over a high-level project timeline, and we've talked a little bit about this various activities already, but just to give an idea of what we've completed so far that we discussed, as well as what's expected to come. So first of all, we awarded the contract July 1st, and we did a readiness review kickoff with Verida on July 15th. During that time, or right after that time, our project management team worked to publish a draft readiness review log and got the tools assembled and together for the teams. We worked closely, the FSSA leads worked very closely with the project management team to go over the log and the appropriate validation methodologies for each focus section of the contract. And then in October, there was some training that occurred with FSSA, as I mentioned earlier, where everyone got training on how to approach readiness review, on using standardized forms and how to communicate and use that collaborative site. On October 8th and 9th, Verida hosted the FSSA team and our project management team on site, and we did a thorough review, that discovery session of each section of the contract, and it allowed us to see what they had, and it allowed us to see areas where we needed to maybe start working on it earlier so we could get it done before the 1st of July, and also how we could be efficient in reviewing and what we could group together. So it was a really good session. We were very productive those 2 days on site and got a lot accomplished and a good understanding of where we were at starting. And we are continuing with readiness review. We've had, as I mentioned earlier, document reviews come through. There, as expected initially, were a lot returned for gaps and needing more information, and that's expected early on in a readiness review because it is a different process, a new process for the vendor, and so that they better understand, Verida is beginning to understand the standards and what we're expecting for each of these validations. So we expected a little bit of document return back and forth early on, with the hopes that once that process is better known, that we'll have less back and forth to get to that. Yes, Verida is definitely ready with full confidence to perform under this contract. So the go live is July 1st, and the goal is to get these activities done for readiness review by March 31st. That way, if there's any residual activities that need to happen, we can make sure that we're fully ready by July 1st with the vendor. And Lindsay, back to you.
Yes, Jamie, does anyone have any questions for Jamie on the readiness review process? Okay, Kristen,
Oh, yeah, I was just gonna, if you could, I put a question in the chat, so it sounds like you were getting there.
yes, thank you.
I had a question about the first section on the 28 accidents. I wondered what kind of characteristics those accidents were. Are they car crashes or, small things like fender bender or a dent in the car or
Okay,
how they be characterized?
thank you, Representative Boyd. Kristen, I'll get to your question in just a minute. Jim, can you take this one, please?
Yeah, they would be characterized as minor accidents or incidents.
Like vehicle accidents or getting on and off the vehicle kind of accidents, or what kind?
It could be getting on or off the vehicle. It could be motor vehicle accidents while in transport. We can pull the actual accidents and incidents if you want to see the details regarding those. Could be, falls, getting out of the vehicle, those types of minor injuries.
It was just a question of, what was meant by accidents. Thank you.
Sure.
Okay, Kristen, back to your question. So this will have an impact. Kristen's question in the chat is the impact of the carve-outs and the transition to pathways later in July of 24, and what kind of impact that will have on the Verida NEMT contract. All of those changes will make the Verida NEMT contract smaller than it currently is. We are working with our actuaries at this point in time to nail down exactly what is expected with those changes before we move forward with that contract. You are welcome. Fern, I see your comments in the chat as well about your continued advocacy and support for the member experience, and I thank you and appreciate that. Does anyone else have questions regarding Jim or Jamie's presentation or anything else they would like to address?
This is Gary Miller. I do have two questions, primarily for Jim, I believe. One, Jim, you mentioned the 100% compliance with vehicles. Are those inspections done where they, if there is a shortfall, let's say something's missing, do you give them time to correct it, and that's what gives you the 100%, or have all of them been that great that they've all been fully compliant when you investigated them?
Yeah, those were scheduled inspections. There is what we would call a corrective action in the event that there is something minor that needs to be addressed. So we can provide a 10-day cure letter or something to that effect that would necessitate getting something fixed. We also have the ability to provide items on scene. So our compliance officers, for instance, if you're missing a step or a component that's needed, our compliance officers sometimes carry that equipment with them, and we're able to provide that to the provider to meet the requirement.
Okay, but either way, it sounds like it's very high success rate.
Yes. Yeah,
and then
a lot of that has to do with the stability of the network, the fact that we've been inspecting these vehicles for a number of years now, and that those providers and the transportation providers know what's expected when their scheduled inspection is due.
And then my second question is, in those, are you still needing to utilize ambulance services for wheelchair patients when you're unable to find a wheelchair provider?
Are we still using ambulance providers to provide wheelchair services?
Yes, when you can't find.
Yes,
okay.
it's very rare. We've seen an increase in wheelchair providers. I think the grants have helped quite a bit with adding wheelchair vehicles to the network, but yes, in very rare instances.
Okay, which brings up just a very minor point, but it's good that this is about the only issue that has been I have been made aware of. Is I do know some providers are kind of uneasy because they feel that technically by doing that, they're billing Medicaid illegally, in that they're charging for an ambulance trip when it's definitely a wheelchair trip. I think this could be resolved by a simple letter from FSSA, basically saying that they're in compliance when these challenges occur. I think I can work with, I don't know, perhaps Jamie and Jim offline to come up with some wording for that.
Absolutely, Gary. We will look at that.
Yeah, I'm not sure. Yeah, I think we need to look and see, because I don't believe we're billing it that way on the encounter side when we're submitting those claims in. It's my understanding, we can go through the details, but I believe you most likely would be receiving like what we call a special rate for that trip to account for the extra, but the encounter is still being transmitted as, at the appropriate level of service. So it's not being billed at ALS or BLS.
Good. That just helps, but they would like that extra level of security if it comes
definitely.
up.
We want to make sure we're not we've got everything locked up on that front.
Okay, that's all I had. Thanks.
Thank you, Gary. Any questions from anyone else? All right. Again, I want to thank everyone for your participation today. I have gone through everyone who is here to update attendance. Jamie, if you could move to the next slide, please. Commission materials are available online, and you can follow this link to get to those. And if you will move to the next slide, there are also NEMT resources available if anyone would like more information. Thank you for being here today. I hope everyone enjoys the new year, and I look forward to meeting with all of you again soon. So thank you very much.